think this might be the jet lag panel in terms of if we think about who's up here and where they're from, but then they're doing very well. Okay, our third presenter is Dieter Wolke, who's a professor of developmental psychology at the University of Warwick. His major research interests include precursors, consequences, and interventions related to peer and sibling victimization and bullying, as well as looking at early regulatory problems in infancy and their long-term consequences, and how preterm birth affects brain development and psychological development and quality of life.
Yeah, thank you very much for inviting me. So I'm not talking about assessment, but I think the conclusion will be, or hopefully, that bullying is very important to assess if you want to see that we develop mental health problems. So what will I talk about? I will first talk about bullying. What is it? Because it's very often used, because in English you have got a word bullying, which is used in common language, while in most other languages you don't have a term for bullying, but it's much more scientifically constructed. So it's important to distinguish that. Then to say that bullying is not conduct problems, and it gets very often confused. We have to battle all the time with reviewers of journals who confuse this. What are the consequences and what are the implications? Now, the first thing is that all children have got conflicts, and conflict is good because you learn how to resolve them. Bullying is different. It's about a power relationship. It's intentional harm doing. It is carried out repeatedly every week. And it is really to have either one person or usually a group of persons to have power over another person. Now, what are the types of bullying? Well, firstly, they are overt bullying, which is from name calling to hitting, kicking, blackmailing, etc. Relational bullying, which in recent years has been looked at more because it's slightly more often practiced by girls. It's like, you're not invited to my party, you can't come, you can't play with us, playing tricks on. It's really a purposeful damage of social relationships. And then, of course, we hear a lot about cyberbullying. I think it's overrated in one way because it's just another mean, because 90% of the bullying in cyberbullying is directed towards someone you know, because it's not fun to bully someone in China and you don't see the effect. So very important is that a lot of research, particularly American research, just talks about victimization and perpetrators. But it's a simplification, because we really have got at least 4 groups related to bullying. The one is the pure bully, who actually perpetrates the aggression repeatedly, but never becomes a victim. You have got the other side of the group, which are the pure victims who get bullied, but never bully others. But you have got a third group, and these are very often the children which you would normally see as classically conduct disordered. Is a group of children who get victimized, but also bully at other times. In a way, they are socially defeated children. Despite bullying, they're not successful. And then you have got the group of neutrals who can be bystanders or defenders. Now, is bullying an evolutionary adaptation, or is it just a maladaptation of societies at staggering scale? Well, evolutionary theorists, their recent publications say that it may actually be, for some people, being a bully a very good thing because it gives them access to resources. I mean, this can be for money, but in particular, it increases in adolescence. And that has very much to do with dating and getting access to the other or the same sex for sexual relationships or romantic relationships. In modern society, it is also access to jobs, money, status, and to gain access to reproductive resources. It also means when you're dominant in the hierarchy of peers, you don't need to fight all the time because people are frightened of you. So it actually protects you against all the time having to do this. Now, if that is true, then bullying should be found in all SES groups, and it should be particularly frequent the scarcer the resources. Now, when I submitted this last week, it wasn't accepted, but this is, I heard yesterday, accepted as meta-analysis in the American Journal of Public Health. And what we analyzed is when you look at bullies, but also victims and bully victims, and I only want to show here the bullies, is that there's hardly any difference, excess, in those who are of the lower social class versus moderate or higher social class. Bullies occur in all social class groups, as much in England, you would say, in the public school, which is actually the private school, versus the community school. The second thing is it related to scarceness? If it's not related to SES, what is it related to? And here, meta-analysis, which was published in 2009, which looks at the relationship of the Gini index, which is basically 0, it's a very equal society, everyone earns the same, to unequal society, the most unequal society would be 1, where the difference between rich and poor is extreme. Now, you may not be surprised that the United States is one of the more unequal societies, with Turkey and the Russian Federation at the similar level. The interesting thing is that the correlation of having bullies in surveys in these 39 countries and the Gini index is a staggering 0.62. The more unequal the society, the more likely they are bullies. And the interpretation is in countries where you promote inequality so that actually anything counts and you're not as sensitive. So some people say, so why is it that all the research started in Norway and in Sweden? It's because these societies are very sensitive to bullies and to having these inequality and the violence. Now, is it a normal rite of passage, or does it have adverse consequences? Now, the first thing I want to show is one study which we did in primary school, and we had these groups of bullies, bully victims, victims, and neutral, and we looked at physical health problems and emotional health problems in these groups. Now, I just want to draw the attention to this because this will come up over and over again, is that the most strongly affected group is the bully victims, who are somewhat socially defeated. Even though they bully, they're not successful. Then the victims, but the lowest problems, health problems or emotional problems, is actually the bullies, the pure bullies in these relationships. Now, here's a study just published a week ago in the United States to show for the United States, because it's one of the very few longitudinal studies yet on bullying history here, which looked at physical and mental health. And you can see the second factor that's important is not just your role, but also how chronically you're actually bullied. If you're bullied over years, you can see, for example, if you look at depression symptoms, if it was just in the past, but in the past and currently, and you have got it at both times, there is a dose-response relationship. The more chronically you're bullied, the worse the outcome. Now, we had heard about suicide, and the newspapers, every month, there are articles about it, that children killed themselves because they were bullied. The question is always, if you have got these news reports, did these children not have depression or other psychological problems before they were bullied? We had the possibility to investigate this in the Augsburg studies, a study of children recruited in pregnancy and now followed up to 18 years of age, 14,000 of them in Britain. And here we look at the reports of the children about suicide, of thinking about, of killing them, ideation, and actually self-injurious behavior. And we have got the mother and teacher talking about reporting on bullying. We also have self-reports, but I'm just showing this. Now, the bullies were not at increased risk here for suicide ideation. The victims were clearly at increased risk, double. But again, the bully victims are the ones who have got the highest risk of suicide ideation. That's at 12.5 years of age. We were able to follow them up to 17 years of age. And we looked at bullying in elementary school and their self-harm at 17 years of age. And we found a rate of self-harm in this community sample of 16.5%. And a quarter of those did actually self-harm with the intent that they want to die. Now, when we looked and analyzed this data and controlled for pre-existing psychological problems, even problems of the families in pregnancy before the children were born, mental health of the mother, etc., what we found is that being bullied directly increased the risk of self-harm, not just via depression that was smaller, but directly. And that's why very often they might be missed in mental health services because they're not necessarily depressed. What it means, the population attributable fraction of 20%, if you think this is a causal relationship and you could change everything else, 20% of all cases of self-harm are related to being bullied. Now let us compare this in the medical field. Everyone knows obesity as a body mass index larger than 30 occurs in 15%, like bullying occurs. But it accounts for only 2.8% of all myocardial infarctions, as published in a large meta-analysis in the Lancet. So actually the effects of being bullied on, for example, self-harm are large. We find this for other areas as well. Now here an example, we have just published, or just a paper came out in First View. We published it previously in the archives for 12 years now. At 18 years of age, we found controlling for pre-existing diagnosis, internalizing, externalizing, depression symptoms in between, psychotic experiences already at 12 years. Being bullied, chronically bullied in elementary school, that's before 11 years of age, increases your risk of having psychotic experiences at 18 3 times. So there's a very strong risk controlling for pre-existing problems. Now, while I was in 2011 for a sabbatical at Duke University, I teamed up with the people from the Great Smoky Mountain Study, and we had a lunch, and I said, do you have data on bullying? And they said, yeah, we did actually use that. We did that in the interview. But in particular, Adrian Ingold was very critical and said, look, we have looked at everything, psychiatric problems, it won't do anything. So they were very, very skeptical about it. Those are the best collaborators because they make you throw everything at it because they don't want to believe that there may be a relationship. So what we did, well, never mind. What we found from the Great Smoky Mountain Study, we published in JAMA Psychiatry last year and in Psychological Science, we found that those children who were bullied, in particular, again, the bully victims, had more health problems, in particular psychiatric problems, that were depression, and the pure victims more often anxiety disorders. They were more likely smoking, using substances, and they showed slower illness recovery by 26 years of age. This study was from 9 years of age to 26 years of age, over 1,100 children. They showed poorer school performance, but in particular it meant that they had poorer exams and were more likely to earn less money by 26 years of age. But in particular, they were more often dismissed from jobs or more often said that they left jobs because they had lost trust in working together with others in teams and were poor in managing their finances. So there are massive economic implications of it. There are poorer social relationships with their parents and support systems, fewer friends of those who were bullied. And they had more often no confidence in adulthood. They could talk about their problems. Now, bullying gets under the skin. And here data which we have just submitted with Bill Copeland and Adrian Ingold and Jane Costello. And first looking in childhood between 9 and 16 years of age, controlling for a range of factors, whether you smoke, drink alcohol, have obesity, other illnesses, infections, etc. We looked at chronic inflammatory responses as C-reactive protein, and we looked at the change over childhood from 9 to 16 years of age. And what you can see, they were measured 6 times over time. The stronger the exposure, the more chronic the exposure of being bullied, the higher was the inflammatory response, chronic inflammatory response. But now the most interesting thing is we looked from 9 to 16 years and assessed whether they had been bullied or were bullies or were bully victims, and looked at 23 years of age of how their inflammatory responses were there, chronic levels. And the interesting thing is we found that there were highest, this is significant differences, highest increase was for the victims and then for the bully victims. But the interesting thing is that those who are pure bullies had the lowest C-reactive protein levels. In a way, it was protective for them in a way of not developing chronic inflammation. So what is the summary of these findings? Well, being bullied by peers has wide-ranging and non-specific effects on mental health. It increases the risk of psychopathology, from depression to psychotic experiences and suicide, general health, wealth, and well-being. So this has got really serious influences. Bully victims and chronically bullied children have the worst long-term outcome. So if you do screening, it's very important to look at these groups. For bullies, once you control for family adversity and pre-existing problems, we found no adverse effects on health, little adverse effects on wealth, but they still had more problematic relationships in adulthood. In fact, in some of the analysis where we have looked, or other people have looked at, for example, their ability of understanding social stimuli, their emotion recognition, etc., we find that they're very astute in understanding others, but are not very empathic towards others, and are very good at manipulating social groups, and often are the ringleaders in the bullying. Now, what are the implications? Bullying is highly prevalent, 15 to 20%. It has mental and physical health problems. It leads to social problems and school avoidance. Of the 16,000 children who have not gone to school for a whole school year, of all of the children who have not gone to school for the whole school year in Britain, 16,000, the majority, are basically they're not going to school because they have been bullied. And there are charities to work on that to recover these bullied children by having Red Balloon in the air, doing it by education via the internet, or having them in special schools dotted around the country. And one of the things I went last year to give evidence at the Parliament in the UK was because there's a new child and family law to see whether children who are chronically bullied should be considered as special needs, because the problems they have are larger than often children who have got physical needs. It affects the economy. It's integrating into the workplace, holding down jobs, and working in teams, because a lot of those, when we have spoken to them in adulthood, say they have lost trust in others. Now, why is it politically acceptable to deal with bullying? And I think that's how it is different, because we always focus on minority groups, on poverty, etc. and groups. But bullies are found in all social status groups, whether in inner city schools or in affluent neighborhoods. It is a universal problem faced by children and parents from all social groups. Policies will have a universal impact across the whole society if we do something and not just focus in. And dealing with bullying is likely to make society healthier, more productive, less risky, and happier. Thank you very much.